This medication, Predmild suspension, drops, final dose form, is used to treat certain eye conditions caused by inflammation or injury. It works by relieving symptoms such as swelling, redness, and itching. Predmild suspension belongs to a class of drugs known as corticosteroids. The daily dosage and optimal timing for this medication should be determined by a healthcare professional. When using Predmild suspension, drops, do not wear contact lenses unless your doctor has instructed you to do so. If approved, remove the lenses before using the eye drops and wait at least 15 minutes after each dose before wearing the lenses again. To apply the eye drops, wash your hands first and shake the bottle well if you are using a suspension form of this medication. Avoid touching the dropper tip to prevent contamination. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Apply one drop into the pouch, close your eyes for 1 to 2 minutes, and apply gentle pressure at the corner of your eye to prevent the medication from draining out. Repeat for the other eye if directed. Use the medication regularly at the same time each day to get the most benefit from it. The dosage and length of treatment will be determined by your medical condition and response to the treatment, so it's important not to use the medication more often or for longer than prescribed. Continue using the medication for the full time prescribed and do not stop without consulting your doctor. If the condition does not improve after 2 days or worsens, contact your doctor. And if the product becomes contaminated, do not use it and seek advice from your doctor or pharmacist. When using Predmild suspension, drops, you may experience a brief stinging or burning sensation in your eyes. If this persists or worsens, it's important to inform your doctor or pharmacist. Remember, your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. However, prolonged use or high doses of this medication may lead to serious eye problems such as increased pressure in the eyes or cataracts. If you experience vision problems or eye pain, it's important to notify your doctor immediately. Predmild may mask the signs of an eye infection and increase your risk of developing one, especially with prolonged use. If you experience new or worsening symptoms such as eye discharge, swelling, redness, or vision problems, inform your doctor. They may need to adjust your treatment. Additionally, if you experience serious side effects such as headache or dizziness, it's important to seek medical attention. While rare, a serious allergic reaction to this medication is possible. If you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using prednisolone, make sure to inform your doctor or pharmacist about any known allergies to this medication or any other allergies you may have. This product may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have had eye infections, recent eye surgery, cataracts, glaucoma, severe nearsightedness, or diabetes. After using this medication, you may experience temporary blurred or unstable vision. It's important to avoid activities such as driving or using machinery until your vision has returned to normal. Before undergoing any surgery, inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you develop a new eye infection or injury, or if you need to undergo eye surgery, it's important to consult your doctor to determine if you should continue using your current bottle of prednisolone eye drops or start a new bottle. If you are pregnant, it's important to use this medication only when clearly needed and to discuss the potential risks and benefits with your doctor. It is not known whether this medication passes into breast milk, so consult your doctor before using this medication while breastfeeding. Remember to follow your doctor's advice and instructions for the best results. When using Predmild suspension, drops, it's important to be aware of the potential for drug interactions. Certain medications may affect how Predmild works, or increase the risk of serious side effects. To ensure your safety, it's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first consulting your doctor. This will help to ensure the effectiveness of your treatment and minimize the risk of any adverse effects. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Remember, this medication is prescribed for your specific condition and should not be shared with others. It's important to use this medication only as directed by your doctor and not for any other eye conditions unless instructed otherwise. Your doctor may also recommend additional tests while using this medication, so be sure to keep all medical appointments and consult your doctor for more information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next one at the usual time. Don't take extra doses to make up for the missed one. When storing Pred mild suspension, drops, it's important to keep it at room temperature and away from light. Different brands may have different storage requirements, so be sure to check the product package or ask your pharmacist for specific instructions. It's important not to freeze the medication and to keep the bottle upright and tightly closed when not in use. And as always, be sure to keep all medications out of reach of children and pets. When it comes to disposing of Pred mild suspension, drops, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. To do this, consult your pharmacist or local waste disposal company for guidance. As for the optimal timing and dosage, it's important to follow the instructions provided by your healthcare provider. They will be able to determine the best dosage for your individual needs and provide guidance on the best time to take this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.